What if the test meant to save your life was the very thing that almost ended it? Meet Beverly. She's 74, sharp, active, and walks 2 miles every single morning. Her grandchildren call her the energetic one. Last Tuesday, she walked into a clinic for a routine screening, feeling perfectly healthy. By midnight, she was fighting for her life in the emergency room, not because of a disease, but because of the test itself. I am Dr. Morrison. After decades in internal medicine and treating thousands of patients, I am here to tell you a truth that most physicians are too afraid to say to your face. After the age of 70, the standard medical checklist in America is no longer your shield. It is a minefield. There are 5 specific tests ordered every single day across this country on patients just like you. And in almost every case, the patient is never told the full, ugly truth about the risks. By the end of this video, you will know exactly which tests to question, which ones to refuse, and the $1 alternative that actually protects your longevity. But first, you need to understand the physiological trap that caught Beverly. Stay with me. This information is the difference between a golden retirement and a permanent hospital bed. I have a confession to make. For the first 15 years of my career, I was part of the problem. I never questioned the checklist. If the computer said screening due, I signed the order. That was good medicine. Or so I thought. Everything changed when a 72-year-old man named Robert walked into my clinic. His daughter had booked a platinum cardiac workup as a 73rd birthday gift. Robert was fine. He had mowed his lawn 3 days prior. No chest pain, no shortness of breath. We put him on a treadmill for a routine stress test. At minute 9, his heart gave out. He collapsed right in front of me. We brought him back. It took 4 minutes of pure chaos, but as I stood in that silent room afterward, I asked myself a question that haunted me. What did we just do to him? We nearly killed a healthy man looking for a problem he didn't even have. I went back to the research, and what I found was staggering. The Journal of the American Medical Association, JAMA, found that unnecessary procedures cause over 800,000 serious adverse events every year in Americans over 65. The New England Journal of Medicine is even more blunt. In adults over 75, the risk of the screening procedure itself often outweighs any potential benefit. In many cases, the test is more dangerous than the disease. Beverly, the retired teacher I mentioned, didn't know this. Her daughter paid $3,200 for a comprehensive wellness package. It included everything, but the very first test on the list, the one everyone calls routine, nearly sent her to the morgue before the doctor even walked into the room. What happened to Beverly is a warning for every family in America, and it starts with a gallon of liquid that most doctors call harmless prep. Beverly followed every instruction like the dedicated teacher she once was. The night before her colonoscopy, she sat at her kitchen table and drank 4 liters of the bowel prep solution over 2 hours. To a 40-year-old, it's an unpleasant night. To a 74-year-old, it is a massive physiological assault. Here is what the screening center failed to check. Beverly's kidneys. While her blood work looked normal for her age, her actual filtration rate was on a razor's edge. This is what we call the aging reserve. As we cross 70, our organs lose their ability to handle sudden shifts in fluids and electrolytes. By 10 p.m., Beverly was dizzy. By midnight, her heart was racing like a trapped bird. She was experiencing atrial flutter, a dangerous heart rhythm triggered entirely by the electrolyte depletion from the prep solution. Her daughter found her collapsed on the bathroom floor at 1 a.m. Beverly spent the next 4 days in the ICU, not fighting cancer, but fighting to stabilize her heart and kidneys. She never even had the colonoscopy. The kicker? After she was discharged, the specialist admitted, "At her age, we probably shouldn't have recommended this in the first place." A 2019 study in JAMA Internal Medicine confirmed this tragedy. In patients aged 70 to 75, serious colonoscopy complications occur at 5 times the rate of younger patients. 5 times. Even the U.S. Preventive Services Task Force, The federal authority explicitly states, for adults over 75, screening should be highly individualized, and for those over 85, it is not recommended at all. But the prevention industrial complex doesn't tell you that. They sell peace of mind, while ignoring the five-fold risk of heart failure and kidney collapse. Beverly survived, but her confidence was shattered. However, her story is only the beginning. There's another trap waiting for seniors, one that involves high-tech machines and a diagnosis that turns healthy people into permanent patients. It happened to a man named David, and it started with a gift from his children that turned into an 18-month nightmare. David was 77 years old, a retired firefighter from Phoenix who still thought of himself as invincible. He fixed his own roof, drove himself to the hardware store, and lived for his morning coffee. For his birthday, his children bought him the ultimate gift of life, a full-body PET CT scan. The brochure called it the future of early detection. It promised to find cancer before it could find you. But for David, that scan was the end of his peace and the beginning of a descent into medical hell. The scan found a 6-millimeter lesion on his prostate. It was tiny. It was ambiguous. But once you see it, you can't unsee it. The system kicked into high gear. His urologist ordered a biopsy, a procedure that involves passing a needle through rectal tissue into the prostate gland. Here is what they didn't emphasize. In men over 75, this procedure carries a significant risk of sepsis, a life-threatening blood infection. 4 days after the biopsy, David was in a hospital bed with a 104-degree fever, shaking uncontrollably. He spent 6 days on IV antibiotics while his family rotated shifts at his bedside, terrified they were losing him. The result of all that suffering? Gleason grade group 1. In plain English, it's a cancer that would have stayed silent for the rest of his life. A study in the British Medical Journal, BMJ, found that up to 70% of prostate cancers detected in men over 70 are overdiagnosed. These are cancers that would never have caused a single symptom. Most men die with them, not from them. David looked at me months later, his voice trembling. "Doctor, before that scan, I was a strong man. Now, I wake up every morning feeling like a ticking time bomb. They found something that wasn't going to kill me, and in the process, they nearly did. And we haven't even talked about the radiation. A single full-body PT-CT scan exposes a senior to the equivalent of 500 chest x-rays. For a 77-year-old body with declining cellular repair, that is a massive dose of DNA damage. But David isn't the only one who fell for the authority of a white coat. Next, I'm going to tell you about Linda. She was a nurse for 32 years. She knew the system from the inside. And yet, she still found herself clutching a treadmill handlebar, watching her vision go gray. Wait until you hear the one question she says could have saved her from a needless heart procedure. Linda Kowalski was the last person you'd expect to be a victim of the system. She was 75 years old and had spent 32 years as a registered nurse in a high-volume cardiology ward in Minneapolis. She had administered hundreds of stress tests. She knew exactly what the monitors should look like. But when her own cardiologist suggested an exercise stress test during a routine checkup, simply because of her age, Linda did what most of us do. She stopped being an expert and became a compliant patient. She said yes. At minute 7 of the Bruce protocol on the treadmill, Linda's world tilted. Her blood pressure didn't just dip, it plummeted. Her vision went gray at the edges, and she had to white-knuckle the handlebars to keep from collapsing. This is a condition called hemodynamic instability, and in a 75-year-old, it can trigger a stroke in seconds. The cardiologist looked at her ECG and saw a non-specific ST segment change. In a younger person, that might mean a blocked artery. In a woman over 70, it is a notorious false positive. It's often just a sign of a heart that has lived a long life. But the doctor didn't see a long life. He saw a reason for a coronary angiogram, an invasive procedure where a catheter is threaded through the femoral artery directly into the heart. This is the moment Linda's 32 years of nursing saved her. She looked at the doctor and said, "No, I am not going to let you thread a wire into my heart because of a treadmill test that half the women my age would fail." She was right. The American College of Cardiology and the American Heart Association published joint guidelines in 2021 stating that exercise stress tests in older adults carry unacceptably high rates of false positives and dangerous complications. They explicitly recommend safer, non-invasive alternatives like a resting ECG or a heart echocardiogram. The stress test isn't the best tool for a senior. It's just the most familiar one in a system that values doing something over doing the right thing. Linda walked away, but thousands of others are wheeled into surgery every year because they didn't have her courage to say no. Now, we come to the final test, the fifth one. It's the one that feels the most harmless. It doesn't involve treadmills or radiation. It's the test your family is most likely to schedule for you because they want to be sure about your minor symptoms. It's the test that put Thomas, a man who still split his own firewood, into a coma-like state for 43 hours. Thomas was 78 years old, a retired postal worker from Columbus, Ohio, who still split his own firewood every October. He was strong, independent, and proud. But his family noticed he had occasional heartburn. Nothing major, just a nagging discomfort. With the best of intentions, they scheduled an upper endoscopy under sedation. They wanted peace of mind. The procedure itself went perfectly. The doctor found mild gastritis, easily managed with a simple pill. But in the recovery room, Thomas didn't wake up. 30 minutes passed, then an hour. His oxygen levels began to flicker and drop. You see, the sedative used, a standard dose that a 45-year-old system clears in 90 minutes, had no exit strategy in Thomas's body. At 78, his liver and kidneys were processing the medication at a fraction of the speed of a younger man. His brain was essentially drowning in a safe dose of anesthesia. Thomas was rushed to the ICU. He spent 43 hours on supplemental oxygen, fighting to regain consciousness. His daughter told me later, "He went in healthy, but he came out frightened. That test took a piece of his spirit we can never give back." A study in gastrointestinal endoscopy found that sedation complications occur at 3 to 4 times the rate in patients over 75. This is why the American Society for Gastrointestinal Endoscopy now explicitly recommends that sedation be reduced or avoided entirely for seniors. So, what actually works after 70? If you want to protect your life without risking it, follow this evidence-based blueprint. Biannual basic blood panels. Monitor blood glucose and kidney function. A simple blood draw has 0 procedural risk, but catches the silent killers like diabetes and renal failure. Daily home blood pressure monitoring. The NIH Sprint trial proved that consistent blood pressure control reduced cardiovascular death by 27% in older adults. A $40 cuff in your hallway is more powerful than a $3,000 hospital scan. Bone density, DEXA, scans, every due years. Hip fractures after 70 carry a 30% mortality rate within a year. This safe, low radiation test is your best defense. Annual hearing and vision exams. The Lancet identified untreated hearing loss as the single largest modifiable risk factor for dementia. Correcting your hearing can reduce dementia risk by up to 8%. Annual home fit test. Research in the New England Journal of Medicine shows this non-invasive test matches colonoscopy detection rates for cancer, with 0 prep and 0 risk. Functional strength training, chair squats and resistance bands. The Journal of Gerontology found this reduces fall risk by 34%. Beverly is back to her morning walks. David is coaching his grandson's baseball team. Linda is helping other seniors ask the right questions, and Thomas is back to his firewood. They all learned the same hard lesson. After 70, protecting your health is not about finding everything that might be wrong. It is about protecting everything that is right. Don't let a routine checkup steal your independence. Protect yourself and your loved ones with the facts, not just the protocols. If this video helped you today, please subscribe to join our community of proactive seniors and families who choose evidence over fear. Now, I want to hear from you. Please share your stories in the comments below. Have you or a family member ever experienced a complication from a routine test? Your story is more than just a comment. It's a warning and a lesson for someone else facing that same decision today. Drop a thank you in the comments if this information helped you. It helps the YouTube algorithm show this life-saving message to the people who need it most. I'm Dr. Morrison. Let's look out for one another. I'll see you in the next video.